Hi, welcome. Hope Zvara with Core Functional Fitness, and today's move of the day is going to be the half camel. I'm sure you have many other names for it, but that's just the name I've become accustomed to. And we're going to be focusing on stretching the front line of the body. So we'll be working through the top of the foot, through the shin, knee, quad, hip flexor, and into the deep abdomen. So right off the bat, if you have any sort of ankle issues, and we all have different set bones, so if you have a deeper set ankle, you may find that rolling up a sock or folding up a yoga strap may help bring the curve of the ankle back in. So that may be a prop that you want to go and grab. In addition, you may be needing 2 blocks. I like using a 4-inch because they're a lot more sturdy and stable. If you find that you have really tight hip flexors and quads, you may find also that a chair or a bench or even a ledge may be more appropriate just to help you stay more upright. So use the props that work the best for you and make the most sense. And we're going to be working with this for about 5 minutes on each side. So I want you to be patient, breathe deeply, and I promise you the long-lasting benefits of a pose like this is going to far outweigh only being in it for about 30 seconds. So what you'll need to do is roll up your mat and push it up flush with the wall. And then finally, again, make sure that you have enough wall space. Take your yoga blocks, and now I'll work the same side as you. Bring your right knee right up tight towards the wall and toes pointing towards the sky. Now this may be the go-to place. This is all the farther you can go. I want you to try to neutral the pelvis to start, and I can already feel that hip flexor stretch. And you can also bring yourself more upright onto the chair as your quad and hip flexors start to give way. Staying here for as long as you need to or like to, or your body is telling you to. At any time, you can step your left foot forward. Almost looks a little bit like a runner's lunge, or some people call it a low lunge. As you start to make your way more upright, I want you to pay attention to keeping the hips level and neutral. So no dumping forward, no hip kicking that left hip up. So take a moment here, get into the pose. I'm going to keep track of time for you so you do not have to worry about that. And as you start to level your hips, you're going to feel that true stretch as to where you really are restricted. Your body pulls itself in the direction that it's most restricted. So if I just stay here, I'm not really going to benefit all that much. I will some, but I'm not going to get to those areas I really need to get to. All right, I'm going to set the timer. So every few rounds of breath, check in with yourself. So I'm going to keep my hands here in order to really keep my hips level. So my outside of my leg and my hip flexor don't yank my pelvis down. You may find that you can get the foot forward, except you need to be forward onto the blocks. Again, this is more about listening to your body and less about trying to achieve the perfect pose. One of my missions in fitness is that we can really start to teach people to listen to their bodies rather than just trying to practice the pose. Big difference. As I check my neutral and lengthen my lower back, I'm not flattening my curve, I'm just lengthening even more into a pelvic neutral, spinal or rib cage neutral. I'm going to really dig into that stretch even more. If you're finding grabbing with the front hamstring, just walk your front foot out a few more inches. You may even find that you can use it as a stake, but find what works. I'm just going to walk mine in a little bit. Nice deep inhalation through the nose. Nice deep exhalation through the nose. Relax the shoulders. Ask yourself where you're putting the tension, and can you let the tension go? So nice deep breath in, exhale, move down into that area, dissolve, create some space. Deep inhalation and deep exhalation. I have an almost 10-week-old at home, and so as much as I try to stand with him and walk around, I do my fair share of sitting right now. So really working on a pose like this is going to help open up the front line of my body, and I'm stuck at a 90-degree angle for a lot of the day when I'm with him. So just taking that time to undo that which you did. Deep breath. And just stay calm. I'm keeping just a little bit of core contraction, not too much, just to help keep neutral, But more than anything, I'm really trying to use my hands to assist the neutrality of my pelvis. You can also play a little bit with a front to back tilt on your right and left hip side. So if I just move my right outer hip a little bit more forward, I'm going to feel that dial turn up a little bit, versus if, again, I let my left hip pull up and my right pull down because this is tight and restricted. The body typically follows the path of least resistance. If you're having tender knees, feel free to pad the knee. The heel is next to the hip, not behind the glute, so make sure you pay attention to that. And then again, just reiterating with the foot and ankle. I am not exempt. This pose is tight for me. I can definitely feel it. Any numbness and tingling? Pay attention to your alignment again. Are you kind of being pulled in a direction that you shouldn't be? You can use the front hand on the front quad and kind of roll it out externally to help even create more balance in the body. Breathe. You're doing great. We have about a minute left. All right, listen carefully. For this last minute, if you're upright against the wall, you're going to come forward onto the blocks. If your front knee is on the floor, you're going to stay there. But if your front foot is flat, keeping your hip bones pulled up, okay, I'm trying to keep neutral. I'm going to walk my front foot forward and slowly move into a lunge. I'm not talking a saggy forward lunge where we just let the hip drop. I'm really trying to, again, keep my hips square, keep a little bit of core support, and really focus on opening the front line of my body. My arms are like stakes. Crown of the head is towards the sky. Deep breath in. And then exhale, just see if you can sink about another 2 inches. Inhale, rise up slightly. And exhale again, sink about another 2 inches. I'm not forcing, I'm working with gravity and my breath. You have about 15 seconds, you're doing great. Focus on relaxing all of your muscles on that right side. All right, nice job, last one. Okay, now slowly coming out. Walk your front or back leg down first, just listen to your body. Roll the toes, and either extend the leg off to the side, move the leg, and slowly now come into a forward fold. Just take a moment here, relax the head, softly bend the knees, grab opposite elbows, take a few breaths here. Notice the difference between the right leg and the left leg, and we're just creating observation. Slowly come back down. What you may have noticed is that the hamstring of the quadricep that you just opened feels a little bit longer. And it may not be a really extreme difference, maybe more subtle, that's why we gotta pay attention. But I want you to notice that that often can be a great thing to practice. That if you have a pulled hamstring or a tight hamstring and you're stretching, stretching, stretching and it's not working, I really wanna encourage you to work the opposite side of the body. So sometimes we need to give that area a rest, and by releasing the opposite side of the body, that side of the body can heal. Okay, let's try the opposite side. So when you're ready, get yourself set up. It's not uncommon to need knee support or ankle support on one side, but not on the other. All right. And then opposite leg comes forward when you're ready. I'm going to start the timer. And just take your time. I've had students where one leg, they're up against the wall, and the other leg, they're almost resting belly on the floor. So take your time if you need to stack the blocks. So if I just come up and not let my body, not do anything to my body, my right hip is severely kicked up. And I'm still feeling a pull in my left leg. I'm not doubting that I'm not feeling a stretch, because I am. But I want to bring that neutral back in. So again, now I'm totally feeling a different stretch. I'm more up in the hip area, and also again down towards the outer line of the quadricep versus just kind of this subtle midline stretch. I'm just gonna move my blocks a little bit. I'm gonna assist my hips so they stay level, and then I'm gonna check neutral pelvis, which turns up the dial even more. So that forward thrust is usually because we're short and tight. So I'm gonna try to adjust that. Good. Now just close your eyes and breathe. I promise you this will eventually be the best 5 minutes of your life. If you're a biker or a runner, this is gonna be a great stretch. If you like using the Stairmaster a lot or the elliptical, this is gonna be a great stretch for you. If you do a lot of sitting, pretty much everybody, this is gonna be a great release. And then again, that front to back with your right and left hip, trying to play around with that. Calm breathing. Just close your eyes and enjoy your breath. And the dog next door. Check in, are you holding your breath? Can you deepen your breath? Are you sinking mental down into the physical? Make this experience threefold. We're almost halfway. You're doing wonderful. Think long spine, neutral pelvis. As those tissues start to give way, the fascia, the connective tissue, you're going to slowly start to notice your body and its ability to just become a little bit more pliable. I do not recommend yourself being forced against the wall. I work with this a lot. This is one of my favorite love-hate poses. So if you're new to this and you are really restricted in the front lines of your body, I want to encourage you to just go slow. Stay with your breath and stay with the sensation. Deep exhalations. Feel your body becoming more balanced, coming into harmony even more. All right, we're into that last minute. So bring your front foot a little bit more forward. Keeping neutral pelvis. Think about sinking with the pubis bone rather than the hip bone. Draw the body upright and gently press the back shin into the wall, sorry. As you exhale, feel your body just sink a little bit more. And as you inhale, just pull back slightly. Almost like you're on a very sweet little cloud. Again, trying to keep your hips level. We want to find that true stretch. About 20 seconds. Last breath, make it good. Stay with me. You've earned it, you deserve it. Your body feels awesome. All right, front leg back. Release the back leg. Now if you're noticing that your knee feels really stiff, that does get better. The tissues are stiff and they're working to become more pliable. All right, back into forward bend. Try not to force the legs straight. Stay with a little bent knee. Grab opposite elbows, lean forward, and just feel the release through the back line of the body. No flaring the sit bones. Feel your belly hollow as you exhale and your lower back widen. Bend your knees and slowly come back down. Great job. So if you find that this was quite a challenging posture and you notice quite a big stretch, I want to encourage you maybe to a little bit of a challenge. For 1 week, come to the mat and practice this half camel. And from day 1 to day 7, notice a difference in change. Maybe practice this for a month straight and notice if the change is positive. So again, if you're a biker or a runner or you spend a lot of your time sitting, I want to encourage you to really release and open what's called the front line of the body. Your body will feel just more effortless, and if you're struggling with a tight lower back and tight hamstrings, it may be time that you start assessing the front of your body, not just overdoing the back of your body. For more information, visit my website at hopezvara.com. or my new website at hopecorefitness.com, and I'd love to hear from you and let me know how you're doing and how you've enjoyed this practice so far. From my heart to yours, from my soul to yours, namaste.